conceptual framework is a method of organizing lectures in order to guide the students through the main points of a lecture. It is especially useful in lectures that have multiple concepts and discrete ideas. At the beginning of the lecture, the instructor goes over an outline slide that lists the key concepts of the talk in chronological order. Throughout the lecture, the instructor returns to the outline slide to highlight where they are. Building a conceptual framework gives students a way to group information and creates conceptual bins that they can then put facts into. The outline also serves as a tool to help the instructor transition between ideas and makes it clear for the students when the lesson is moving on to a new concept. Next, you will see Dr. Corey Hanley using a framework technique in a lecture about valve disease.
Okay, so today we are going to cover the pathology of cardiac valves. Kind of fun. We're going to have more pictures than some of your lectures recently, and actually more pictures than the one I gave Friday. I have no disclosures, and what we're going to cover today is sort of a laundry list of disconnected topics, with the exception of that they all involve the valves. So we're just going to go through them. At the end of the PowerPoint, I included some additional pictures of different pathologies that we will have covered in the lecture. If I have time to go through them, I will. Otherwise, they're labeled if you want to look at them. They're just more examples of what we saw. Okay? All right, so got all this to go through. Let's do it. So
now that Dr. Hanley has set up the lecture, she launches into her first topic.
So just as part of the intro, when we're talking about valvular disease, there really are two basic categories. One is congenital and one is acquired. Now the congenital
Later in the lecture, Dr. Hanley comes back to this table of contents slide and takes student questions before moving to the next topic.
Oh, the question, yeah.
Are the Inishgal cells, do they do damage to the cells?
Do the Inishgal cells do damage? They are the macrophages, so they're kind of cleaning up. It's everybody else around who's doing the damage. I mean, they will eat stuff. So if you leave it out, they're going to eat it, you know. But they're more of the cleanup crew. They're more of the beginning of that healing process. But it's more. Say again?
They're still functioning
normally. The macrophages are functioning normally, yeah. Basically, the immune system, the plasma cells have secreted antibodies that are trashing. They're starting the entire immune response on cardiac myocytes and on things in the valves. It's just, and so the macrophages show up as part of that normal sort of, we're here to clean up, what in the world have you guys done kind of situation. Okay. Infective endocarditis. This is due to microbial colonization. We typically think of it as being bacterial.
Now here's Dr. Hanley discussing why she uses this technique.
I typically use the table of contents slide when I have really a laundry list of things that I have to get through, a bunch of pretty much separate entities. And I feel like it shows the class at the beginning what we're going to be going through. And then I repeat it during the lecture to help people take a pause, help myself take a pause, focus, think about what we just did, ask a question if you want, and then sort of clear your mind and move to the next thing. Because when you have a lecture that's got like a lot of separate entities, otherwise it can become a big run together. And I think it makes it more difficult for students and for the lecturer to sort of keep track of where you are. It also helps me let students know that the question you just asked, we're going to cover it in a minute because you've seen the table of contents, so you know that's coming up. So that I think also helps people focus. So that's why I use it.
To summarize, when building a conceptual framework, the instructor starts with an outline slide and then leads students through an overview of the lecture. Throughout the lecture, the instructor returns to the outline periodically. At the end of the lecture, the instructor closes with a quick recap of topics covered today.